All right. Hello, everyone.
Hello.
You may be seeing the recording message. I just want to let everybody know that the portion of the meeting tonight that will be recorded is just the presentation. Once the presentation is finished, we will stop recording so that people can have time for questions and answers. But the reason for recording it is that we do want to make that available for members of the community who weren't able to attend tonight. So we will be able to have that recording online. We do have voiced interpreting, ASL interpreting tonight, as well as closed captioning available. If you want to use the closed captioning, you can click the button down at the bottom to see the live transcript. If you do have any questions, you can type in the chat and we can try to answer that, especially if it's a technology related question that you need to get resolved before we get started on the presentation. All right, I'm just going to see if we've got any more folks who are waiting to come in.
DT, I'm just muting people and turning off their cameras as they come in.
Okay, good to know. Thank you. For those of you who have just joined us tonight, I'm just going to go ahead and let you know we are recording the presentation portion of this session, just the first 10 or 15 minutes or so, while I go through the information about 988. And then after that, for the question and answer period, we will not be recording. I do also want to let everybody know that we do have some members of the press here tonight. We don't expect that anybody will be quoted without permission, but I do want you to know that we have members of the press in the audience. All right, I'm just going to double check with my team here, see if I missed anything before I go ahead with the presentation. Team, Jenny or Jennifer, was there anything else I was supposed to announce?
Nope, you're great. Start anytime.
All right. Well, then I guess I'll go ahead and get started. Welcome, everybody. I just want to thank you so much for taking the time out of your evening to come to this presentation. Some of you may be familiar with this concept and some of you may not be, but I want to inform everybody tonight about what 988 is and to give you some information about it. You may have a lot of questions ready. You may have things that you're wondering about, but I will ask you to hold your questions until the end of the presentation because we will have plenty of time for question and answer and discussion after the presentation is over. So 988 is a crisis response system that is being established. And this will help people in the state of New Hampshire to communicate their needs for crisis services. And you can see we've done these listening sessions throughout the last few months. And this month, we have our opportunity as the deaf and hard of hearing community to get some information about it. And it doesn't matter your mode of communication, whether you use American Sign Language or cued speech, or whether you use oral communication or closed captions, we do want to make sure that everybody has access to this information. We do also want to make sure that we have some time for people from within the deaf community to share their thoughts, to share their feedback, and any concerns that they might have, because we really think it's important to get some input from the community. So tonight will be your show as soon as this part of the presentation is over. I'll give you just a moment to look over this slide. You know, I think it's pretty common in deaf culture for us to forget to introduce ourselves. And I'm ashamed to say that I have forgotten to introduce myself. I am DT Bruno. I am on the 988 Planning Commission for the state of New Hampshire, focusing on communication and outreach to communities about 988 services. During the day, I work at Greater Nashua Mental Health as a clinician. I am also a community health worker, focusing on public health and pro health with DMH. So I am deaf, obviously. I am using American Sign Language to communicate, and I know it's so important for us to introduce ourselves, and I'm sorry I forgot to do that. So let me talk to you a little bit more now about what 988 is. This is a way to access services either through phone or through text, and it's a way to get services in any kind of a mental health crisis. And I'll share lots of information with you, and also any questions that you have at the end. I do want to make sure that we take those back to our planning committee to think about ways that we might be able to improve this service so that people can benefit the most from it. So people can use 988 anytime they're feeling especially emotionally overwhelmed or things like that. I know that also it might be tough because it's a new system. So if you have questions or things come up for you, you can feel free to reach out to me and I'll be happy to help. "988 is going to go live in July of this year. So the summer of 2022, 988 will be available for services. And that's what we'll be discussing tonight, is how that's going to work.
Okay.
So you see on this slide the three different phone numbers that are listed. We have 988, we have 911, and we have 211. 911 and 211 have been around for a long, long time. And you may wonder, why we need this other phone number, 988, like what's it for? So 911 and 211 have really done, the lion's share of the work over the decades. But what people have noticed is that for mental health issues, for substance use disorder issues, for suicidal thoughts, people who respond to these types of calls really need specialized skills and training. So 911, of course, will still be active for other types of emergencies and always has been. 211 is available for information, for social and community supports. But 988 is going to be the place to go to if you are in some kind of a mental health or substance use crisis. You can access it not only through the phone or text, but also online. And the staff who respond to calls for 988 will have training and experience to be able to help folks who are in a crisis. You may just be feeling very overwhelmed, very sad, very angry. You may have a drug or alcohol addiction problem. Those are all reasons why you can call 988 and get some support. So what do we mean when we talk about 988 and mental health or substance use or suicidality? The idea is to help prevent some of these issues. And the people who answer your calls or your texts or your online access are going to help refer to folks in the community who can support you, who are local to you, whether that be counselors or other community supports. Mental health supports are really critical. And that's something that I really want to make sure everybody understands. And it's, the 988 system is a way to try to solve some of the gaps in support services that we're seeing in the community. So you may be thinking to yourself, what does mental health mean? It can mean a lot of different things. It can mean that you might have depression, you might have delusions, you might have trouble with escalating moods and depressed moods, you might have an issue with grief. There are lots of reasons that people might struggle with their mental health. Substance use might mean heavy use of drugs or alcohol or medications. They could be prescription medications that maybe are not prescribed for you and that you find you have become addicted to. Suicidality means that you have thoughts of harming yourself or perhaps are attempting to kill yourself or thinking about killing yourself. So those are the three specific experiences that people might have that would lead them to want to make use of 988. Mental health can include lots of things about your emotions, about your thoughts. It includes many, many things. And 988 is going to focus on um, very difficult feelings that you might be experiencing, thoughts that are very challenging to you, things like that. You may be feeling fearful of the future and wondering what the future holds in store for you. You may have feelings of, I wish I were never born, or, I'm just not sure how I'm going to get through the day. Um, some people talk about, oh, my heart hurts. They just, I've got too much to handle. It may be that a person experiences, very overwhelming emotions and intense feelings of distress. So this is what we mean when we talk about struggles with mental health, especially specific to this presentation. I'll give you all a minute to read over this and then I will continue. So to sum up, we use the sign substance use SU to talk about substance use disorder. It can mean the use of alcohol, tobacco, whether that be smoked tobacco, chewing tobacco, other types of tobacco. And what we really mean is misuse, very heavy use that has a negative impact. Smoking a great deal, drinking a lot, taking a medication that wasn't prescribed for you or taking what's prescribed too much. And so these are all examples of substance use and misuse specifically. Some people misuse substances as a way to cope, as a way to manage their emotions. So substance use disorder or addiction is another word for that, can have very negative consequences for people. You may have experienced this yourself, or you may know people who have experienced substance use disorder. And 988 is a great way, or will be a great way, to get connected to supports and resources to help. So this is the last slide that I will share talking about mental health, and then I'm going to talk a little bit more about the 988 system as it will look. Suicide means thoughts or feelings where you wish that you weren't alive anymore, feeling like you can't go on, you can't find a way to go on living. And suicide means actually death caused by injuring yourself. So these are feelings that people may have, and it's important that you feel that you can express those feelings and have a place where you can receive support to keep yourself safe. And 988 will be the place for that. 988 is going to be available all the time, nights and weekends. And so anytime you might be feeling this way, 988 will be available. What's really important to know is that whatever of these types of experiences you might be having, 988 is going to be there for you. I know that many of us have had hard things that we've had to get through, and that you might need a feeling of help and support to give you confidence that you can heal and move past this. Some people depend on family supports or community supports. And it's really important to have those, as well as access to healthcare and other types of supports, so that you can best handle the difficult times in your life, the difficult thoughts or emotions that you might be experiencing. I want everybody to understand that you're not alone. Many, many people have these types of experiences. And it's important to also know that people do recover and go on to get well, even though they may have experienced very difficult times. So, who can use 988? Everyone and anyone, whether it be a parent, whether it be a young person, whether it be a friend, it could be, somebody who lives near you, a teacher in your community, a coworker, yourself. You may access this for yourself. Anyone and everyone will be able to use 988. When can I use 988? 988 will be available not during limited business hours, not just during the daytime. It will be available 24 hours a day, 7 days a week, overnights, weekends, anytime you need it. 988 will be here for you. Some of you may be thinking, well, I already, I have counseling, or I have some kind of a mental health diagnosis, or maybe I don't. If I don't have those things, can I use 988? You absolutely can. Anybody can use 988, no matter their history with mental health. 988 is open for anyone at any time, 7 days a week, 365 days a year, through texting, through online chat, or through phone. So I'm going to explain a little bit more now about how 988 will work. When you or a family member or a friend, someone in the community, maybe a community provider who is providing support, calls to 988, either through text, through a phone line, or through an online chat, you will be connected with a qualified, non-judgmental support person, a skilled staff member, who will be there to respond to you and find out what you need, and how best to support you. They will be there to listen to you, help to validate your feelings, help to soothe and calm you in the moment, and help to make sure that you can get to a safe place and feeling safe. Sometimes we just need someone to listen to us, right? Sometimes that's really all it takes. Sometimes you might ask for a referral for continued support.
Plug in right there.
Most often when people call into a service like 988, they will work with the crisis person on the line who will be able to help them get stabilized and calm and safe. And they will be able to, discontinue the call there. However, if you are still feeling like you are in danger of self-harm, or if you're still feeling suicidal, that crisis counselor can discuss a safety plan and can also dispatch someone to your home who can come and meet with you, who can check in to see how to support you. As a deaf or hard of hearing person, you may wonder what that could look like for you. And that's a good question, because we do not have all of those answers right now. What I would love to hear from you tonight is what you would like to see if that situation were to happen to you, and what do you think would be the best approach for you? New Hampshire has 10 community mental health centers throughout the state. And many of them, if not all of them, have what's called a mobile crisis team. And what that means is when you call 988 and you talk to someone and they realize that this is a pretty serious need and you need someone to be there in person with you, they will then reach out to your local community mental health center and have them send out their mobile crisis team. You know, New Hampshire's a pretty small state, so hopefully we guarantee that that response can be less than 2 hours anywhere in the state, and that will be the goal. That mobile crisis team that responds in person will be made up of a licensed clinician as well as a peer support worker. So there will be 2 people who will be able to respond and be there on site. As I mentioned, though, you can still receive that support either through phone or text or online chat virtually at any time. And you don't necessarily need to have someone come to where you are if that's not what you need in that moment. "98% of the time, calls to these crisis lines don't require an in-person response. But the vast majority of the time, people are able to get the support they need from the crisis worker on the phone or on the chat. If, however, someone does need to be dispatched to you, that crisis worker will stay on the line with you, either through chat or through their online service or through phone until that person arrives to you, to where you are. And they will also check back in with you within 48 hours to make sure that you are still receiving the support you need. Confidentiality. Everyone has the right to privacy and to protection under state and federal laws. 988 cannot violate your right to privacy and confidentiality. I know it can feel a little challenging sometimes maybe to be trying to communicate with somebody you've never met before, but I do want to reassure you that whoever you speak with in 988 will be non-judgmental and will be there to support you. You do not have to share your name or your location. You can choose to remain anonymous. And again, if you do need someone to come to where you are to meet with you, to provide support, they can do that. It can be at your home or it can be in the community. It could be at a park, it could be at Dunkin' Donuts, wherever it is that you need. And again, just like any of your other health records, every piece of information within this 988 system will be kept strictly confidential. You know, because New Hampshire is so small, it's important to recognize that, you know, you will be connecting with members of your community and you will be able to get the support you need. We all need help sometimes. You are not alone. It's okay to ask for help. Asking for help is a sign of strength. So, can I call 988 right now? Not right yet. Remember when I first started, I said that 988 is going to go live in July of 2022. So it is not ready to take calls right now. For now, there are 2 phone numbers you'll see here on the slide. The National Suicide Prevention Lifeline, which is the first number that you'll see. That service has been in existence for quite some time, but that is going to be transitioning over to the 988 system once that is live. Now, as of January 1st this year, New Hampshire launched the Rapid Response Access Point, which can be reached by the phone number you see on the slide there, 833-710-0000. 6477. And the purpose of that rapid response line is to help those mobile crisis units get dispatched and connected with folks in the community who need them. And of course, as these services change and morph over the next few months and do become active, we will be sharing that information with the community. So we've got ways you can help. This open session tonight is an opportunity for all of you to ask questions, to share concerns or thoughts or feedback that you might have, so that we can make sure that this crisis response team is ready to serve the needs of the deaf community. We will also be sending out a survey to those of you who are here tonight. So if you can please complete that survey. You can also reach out if you have experiences where you feel like, I think there might be a barrier here, or I think this might be a problem. Certainly do reach out and let us know. We do want to make sure that we try to spread this information far and wide. And so anything you can do to help spread the news will be very helpful. And again, completing our survey will help make sure that we get this service to be as effective as it can be for this community. So the PowerPoint that I used tonight and the recording that was made of this presentation are going to be sent out to all of you who were participants tonight. At this point, that will also include a survey. And so when you receive that survey, our goal is to get feedback and comments from you about what you think can be done to make sure that 988 is as effective as it can be. And we really appreciate any time you can give to completing that survey. I'm going to turn the PowerPoint off here in just a moment so that you'll just see me on the screen, as well as one other person, and we will then start the community conversation and stop the recording at that point. So just one moment. All right, so if we could stop recording now, Jennifer.